Count it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
You pass.
Thank you.
Do you mind if I drop you? Or you guys running out of use? Huh? Are you doing time or? Huh? Are you doing time or are you running out?
Hi everyone, thank you for coming today.
Can I go?
You want to test the mic? Hello, 5, 4, 3, 2, 1. Does anybody need a wipe? You already got that.
What a pro.
You got that? All set? I can ask the crew to come up. And we'll be starting. We will have Jeffrey Flax, who is the president and CEO of Hartford Healthcare. And if you need names and spellings afterwards, we're happy to do that.
Good morning. These are unprecedented times. We're asking people across the entire healthcare system to work through issues that were almost impossible to plan for. I'm enormously proud of the work that our entire staff, our governmental officials, our municipalities, and everyone within this region are coming together, working together to respond to this matter. We today recognize all of our staff, the discretionary efforts that people are giving, their responsiveness, the sacrifices they're making to respond to this. It's why people go into healthcare, and it is truly remarkable. You're joining us in the COVID-19 Command Center. And this command center has been set up, it's operating 24 hours a day, each day of the week. And we have literally had thousands of encounters with people in our community that we're coordinating with, answering questions, and responding to. We are in constant contact with our community and responding to issues as they arise. Today, we will be announcing across all of Hartford Healthcare restrictions that we're putting in place relative to our visitor policies across all 400 locations. And we also will be putting in place enhanced communication systems. So I'd like to introduce our Chief Medical Officer, Dr. Kumar, to further elaborate on the moves that we're putting in place today.
Thank you. Thank you, Jeff. So as many of you know, Hartford Healthcare has been preparing for this for several weeks now. And I think we're very proud of where we are right now. With all the preparations we have done so far, I can update you that we've tested several patients within our organization. All of them have been negative. And it's important to emphasize the point that the patients interact with our healthcare facility. We actually follow the standard work. What we prepared, we put that in motion. And we were able to identify those individuals appropriately, put them in the right place of isolation, negative pressure rooms, and manage them conveniently. So we feel we're very well prepared in Hartford Healthcare, and we've done a good job in this preparation. But now, under Jeff's leadership and our team's commitment to the community and to the healthcare workers, the colleagues across the Hartford Healthcare, we're taking a next step, which is very much needed across the institution. Some of you know, we actually instituted a travel policy for our colleagues across the Hartford Healthcare. And we made it clear that international travels is not allowed for non-essential reasons. Even domestic travels were banned at that time. And that was one step coming closer to where we are right now. Given that 4 patients have been identified in the state of Connecticut, and there's a real risk of community spread right now in Connecticut, we're taking a next step at this time. And this is our response and preparedness, proactive approach as how we manage the situation, and which is on our doorstep right now. So today we will be restricting visitors, only 1 visitor per patient across all acute facilities of Hartford Healthcare. In our those individuals who are going to be coming as visitors will be screened for symptoms or travel. And if they're found to have fever or any cough or any symptoms which might sound like a flu-like or a illness which should concern us, we will make sure that those individuals are appropriately managed and taken care of at that time. And we'll provide care with our compassion and all the resources we have in the system. For our nursing home facility, we will be banning all visitations at this time. Now, there are some exceptions we will need to make on compassionate ground. the individuals who really need the family members given end of life or other scenarios at the time. We're going to work with our values in providing that kind of a individual approach to our patients and colleagues. For assisted living, we would be again restricting some of the visitations as well, and there would be less of an exposure to our patients, to the community. Now, all these measures we are taking to keep our community safe and to keep our colleagues across the Hartford Healthcare safe. We're also announcing a new way of connecting to the community. We are rolling out a new text system, a 24-hour time, 24 hours, anytime you can text 31996, 31996, and write in the message COVID-19 with no space or no hash in between, COVID-19. And you would get real-time update from Hartford Healthcare's preparedness and what are we doing different or new at this time. And I hope this is a great resource for the community and the members of our society here, which we can advise in how to protect yourself, what precautions you need to take, and what healthcare institution like Hartford Healthcare is doing at this time to protect her. And we've been fortunate enough to share our knowledge with a lot of other organizations across the state of Connecticut and beyond. We'll continue to do this. Our outreach program with the call center, which started last week, which Jeff talked about, has been very successful. And now this text message will give us a further real-time information to our community members at this time. Now I'm going to introduce my colleague Beth Ciari and Dan Combard, who'll be leading this effort in the call center and give you some updates on that part here. And after that, Keith Grant will join and answer any of the questions you have. Thank you.
Thank you. We could not be more pleased with the response that we've gotten from our call center. We've received over 1,000 calls from across the country, from clinicians, from patients, from concerned family members, just looking for information that we feel really is the truth and the most up-to-date at that time. We've gotten calls from Washington State, we've gotten calls from North and South Carolina, Illinois, Mississippi, and Massachusetts, Rhode Island. Lots and lots of calls from clinicians at other hospitals asking for our advice. And really, this is why our team goes into healthcare. So our physicians, our nurses, we go into healthcare because we want to help people. And this is a way for us to help not only our community, but as it turns out, the nation. So there's nothing more fulfilling than to take a call from a 70-year-old woman who has some respiratory issues and wants to know if it's in her best interest to wear a mask everywhere that she goes. And so we were able to give her the information that we got from our clinicians, and to hear her say, this is so wonderful and thank you so much, Hartford Healthcare, for putting this in place, it is really, really heartwarming to all of us who are doing this work. Dr. Kumar, do you have any?
Sure. So I was going to say, we live in an amazing time. The public has an enormous amount of information at their fingertips. The sad thing is, in this situation, a lot of the information, in particular what they're getting from the internet, is wrong. They're inundated with information, and it's quite often inaccurate. The center is here specifically to provide timely, accurate information. What's important about the center, we are updating our information continuously. You don't see that on the internet. So the center provides a service that cannot be found on the internet. Even the doctors, we have a lot of doctors calling in here, asking questions, asking for information. We have up-to-date information. We provide that for them as well.
And Keith Grant's going to talk about emergency preparedness, infection preparedness across a healthcare system and what that means when you are more than a hospital.
Yeah, absolutely. Thank you. So I think for us, initially one of the most challenging piece of it is to decide how to approach this. And I think one of the things, working with our leadership, we identified, firstly, let's assess our resources. Let's assess primarily the primary need. And I think the primary need that we assessed initially was the fact that, as we've all said so far, the correct information going out to the public. So curbing the public hysteria, and I think Hartford Healthcare has made a significant leap forward, providing a resource that's not just to serve the Hartford Healthcare community, but the Connecticut community, and we're learning a national community base, and that's exceptional. The other piece of it is identifying what we can do clinically to address this, how we can prepare clinically to address this. So we've had multiple training scenarios with our clinical folks just to get them prepared for this. This is something that we've been preparing for a long time. The good news with this process is we have time. We've had time to prepare for it. This is not much different from MERS-CoV or SARS, so to speak. So that's within our toolkit that we've been using over the last few years to prepare for this. The other piece of it, as I said before, not just information, but communication. Communicating with our providers, basically assuring our providers that we will provide the capability for them to be safe. We've seen for transmission, there's a number of providers who've actually contracted the disease process through treatment, through in the process of delivering care. So we've assured our providers, we've provided the tools in order to ensure that our providers are safe. Ensuring that our communities are safe. One of the efforts that we're putting in place right now, not just ensures that Hartford Healthcare partners, and the patients that are within the borders of Hartford Healthcare is safe, but also that the community will limit the exposure, potential exposures to the community. I think this is a big step. It's a great step, and it will help us to ensure that everyone is safe from a community perspective and from Hartford Healthcare perspective. Thank you.
I had a question.
Sure.
If you are infected with the coronavirus and you get out, can you get it again?
That's a very good question. So I think from a scientific perspective, the good and bad with the coronavirus is there's so much we're learning about it, right? So for example, over the last 2 to 3 weeks, we've learned that the COVID-19 disease process, there's 2 species of coronavirus that's causing it, right? And this knowledge is 2 weeks old, right? And the process has been out for months. So to answer that, I would say within the next few weeks, hopefully within the next few weeks to month, when we start scientifically analyzing this even further, we could see more. But right now, it's very difficult for me to answer that question. Has there been cases where someone is negative at this point, well, positive, then proven negative, and then at some point being positive again? It's very difficult, and the reasons why primarily testing for a cure isn't something that's advised. So if a patient comes in and a patient is treated, right, assumed treated, and symptoms have resolved, we're not encouraging testing for a cure. So it's very difficult from a scientific perspective to then say, I tested, it's negative, and now I test again and it's positive.
Is a vaccine the only way to put an end to cause it to eventually die down?
It's a great question. So as many of you know, the vaccines have been trial phase right now. We don't actually have any vaccine ready at this time. It might be about a year or a year and a half by the time we see a real vaccine to manage that. These virus behaves in a way where the vaccines is the best preventive strategy. And I think when the time comes, when the vaccine is ready, I think it will be in a much better place. But there are some antiviral medications, such as for influenza, we've been able to develop. I think the research is very early stages right now to comment on that.
How long do you expect these visiting restrictions to be in place for?
You know, we review our processes almost every day, every day, and it depends on what the community spread and epidemiological behavior of this virus has been. We anticipate it is going to be for several weeks at this time, but the restrictions will be lifted if things change. So we will decide as time goes by.
We're hearing some talk, and I know this has not come from the state yet, but we're hearing some talk that there might be a positive case at St. Vincent's in Bridgeport. Is there any truth to that?
There is no truth in that.
So you guys
Yes.
have had no positive?
We have not had any positive case of COVID-19 in Hartford Healthcare. Can I?
No, sorry.
And also, we have not had any colleague who has been exposed to COVID-19 as well.
And speaking of testing, are you guys now set up to do testing, or if so, when is that going to start?
So testing has been somewhat of a challenge across the country. We've had limited supplies of the kits to the states that, delivered, and we are relying on our DPH colleagues and maybe some private labs, but not quite there yet, to be able to do the testing. Hospitals and our centers can collect the samples. Samples still need to be sent out to DPH and other areas for testing to be done.
Do you anticipate being able to do it on site? I mean, I know Greenwich, I think, is starting today, Greenwich Hospital.
Yeah, we anticipate that as well. I'm not sure about the Greenwich Hospital, but we are working on that to bring on site as well.
When it comes to some of your workers,
Yeah.
in addition to having a mask, what other ways can they actually protect themselves when they're coming in contact with patients who may have symptoms?
Yeah, so I'd just like to clarify, in Hartford Healthcare, we call all our members colleagues. There are no workers, they're all colleagues. So I just want to make sure that we use the right language. And our colleagues have been trained, they've been advised, they've been provided the protective gear to manage what needs to be done at this time. The most important thing at this time is cleaning your hands, obviously. 20 seconds you spend on the sink or with soap, or you use any of the alcohol-based rubs to make sure you're cleaning. And I think our teams are doing a phenomenal job. They've really understood, they've understood the protocols. It's been deployed in every single part of the organization, so I feel comfortable at this time.
Are there enough face masks to go around?
Are there enough face masks to go around? We have adequate supplies to manage our colleagues and the patients in Hartford Healthcare at this time.
I was just gonna ask, do you have any concerns about running low or out of any other supplies?
We always have concerns because we are still in the early stages of seeing the development in Connecticut, and over the next few weeks we will see different scenario. But our teams are responding in the most appropriate way, making sure we have a contingency plan, we have other access points for those kind of supplies to have at this time.
The drive-through testing, is that kind of proceeding to you?
Thank you for asking. We have been testing a drive-through testing process, the collecting the samples, but we are not we are unable to do the testing without DPH's input at this time. So testing still relies on DPH. We would love to actually offer the testing to more members of the community and colleagues across the Hartford Healthcare, but we have tested it out. We are ready to roll this out from Hartford Healthcare perspective. Our resources and our capabilities are ready and ready to deploy. We're waiting for some more clarity from the state and other governmental agency to advise on testing side.
Because only doctors can administer the test, right? So this additional kit that Connecticut got, 600 tests, so would you ask for some of those if doctors here felt there was a need? I mean, is that how it's given?
Yeah, the test needs to be ordered at this time on anybody who's symptomatic at this time, and the physicians needs to order the test, and the testing is sent to the DPH location or any other private lab location to be tested at this time. The challenge we have right now, the CDC and DPH guidelines, is test can only be done on symptomatic individuals. Now, as you know, this disease can present in many of the members of the community when they're asymptomatic, but there's a high risk of being exposed to some area they might have traveled or somebody else who might have had the disease. And that's why some more testing or capability of testing would help augment our capability.
Let me play devil's advocate for just
Please
a second.
carry on.
Let's say, I've got mom and dad in a nursing
Yes.
home. It's already very sad for them that they're separated from me.
Yeah.
What would you say to me to convince me that this is worth it to not see my mom and dad for maybe a month or two?
I just want to be clear, you're talking about the visitor restrictions.
Yeah, exactly, on
Yeah.
the nursing homes.
Thank you. I think most of the community members and even the patients would understand what we are putting this in place right now to protect themselves at this time here. And we are able to connect you with phone or any other capability to our individual members who are within our organization. Look, our Hartford Healthcare has always worked with the idea of compassion and trying to create a scenario when a mom and dad who's elderly and struggling with that would like to see the son, we will do what we can do to accommodate within certain reasons, to not expose you or the members of the community to undue risk at this time.
Are nursing home restrictions or visitations more limited than, say, a hospital at this
That
time?
is right.
They are.
That is right. Thanks for asking this. Nursing homes, as you know, a lot of our members who are actually living in nursing homes or assisted living, they're elderly, they have some other comorbid disease such as the diabetics or heart disease. They're at higher risk and the mortality rate is higher as well. So we are taking extra precautions.
Do you have any?
Oh, I'm sorry, go ahead.
Do you have any advice for the elderly who are not in nursing homes?
Well, I think, first of all, not to panic. Second, if they are tech savvy, subscribe to our text. And if they're concerned, call our call center. So these are the three things I will say. 860-972-8100 is the number. After that, wash your hands. If you're able to limit your movement to large gatherings or any other any place which high risk of exposure, make sure you protect yourself. And at the same time, if you feel sick, do call us. We're here to help. We're here to support at this time.
And I'm sorry, can you just go over again quickly what exactly you're doing to screen the visitors who are coming into the hospitals, what they're going to face when they come?
We would be asking questions. Have you traveled to any of the countries which are deemed level 3 and level 2 by CDC? We're also asking, have you had any international travel? Because some nuances in that as well we want to understand. We're looking at the temperature, whether they have any fever. We're looking into whether they have had any cough or shortness of breath at this time, or have they been caring for somebody who's been sick at home or come in contact who might have visited someplace they could be sick.
So is that to say that all visitors that come to the hospital will have to get their temperature taken before they can come in?
That is right. If somebody can feel a little warm, I think we'll take a temperature at the time. You have a question? Yeah.
How many people die from the flu every year?
18,000. Thank you very much. We have very informed colleagues here in this room here. Thank you very much.
I just want to circle back. When you talk about maybe any patient who may be in hospice, and when it comes to the family members and them coming to see them, those restrictions, they wouldn't be able to see them? How would that work?
Again, I go back to that. I think if we work with the values of compassion and caring, and those individual patients who are in hospice or end-of-life care, we will make exceptions at that time to make sure the family members get to their loved ones at that time. But they would go through the same screening tools and make sure we take all the precautions at that time.
As formidable as all you guys are, the best treatment is still to stay home, right, unless you're pretty bad off, right?
Well, best treatment for most things, you use common sense, and after that, stay home if you're sick, or limit your exposure to somebody who might be sick at this time.
But I mean, like, for someone who might ordinarily have gone to the doctor at some
Thank you
point,
for asking.
You know?
Yeah, if you're concerned about your health, you've got some flu-like symptoms coming in, I think common sense comes first. If you feel you're really sick, you can't breathe, you can't manage yourself, can't take care of yourself, we're here to support, we're here to take care of you. But if you are able to manage yourself at home and you've got a bit of a flu-like illness, please call our call center, connect with our team, and they will advise you appropriately whether we can offer you a virtual health visit, or we can offer you we can get you, invite you into any of our centers to examine. Or advise you to stay home at that time and call back later in case the things change. Any other questions? Do you have any follow-up? Thank you.
I would thank all of our staff members, our team. At Hartford Healthcare, we stand ready. We're prepared. We're using the full extent of our resources and capabilities to do whatever is possible to collaborate with our state and federal authorities and to lead within this community and to ensuring that we're protecting every person who works with us and every person within our community with all of our capabilities. Thank you.